Welcome to Helios Skin and Hair Clinic YouTube channel, and I'm Dr. Shraddha, dermatologist.
I'm Dr. Yamini, dermatologist.
And so today is World Vitiligo Day, and we are here to clarify your doubts and clear some myths on vitiligo, and also suggest what are the treatments that are available today.
Today being Vitiligo Day, could you throw us some light on vitiligo?
So we've been treating vitiligo for the last 15 to 20 years, right from our MD days. So vitiligo is basically an autoimmune condition where the pigment cells are destroyed by our own body cells. So that's why people do get some patches of white patches in the body where there is no pigment. Now it's not visible in the light skin color, but in the darker skin types it does look obvious and does have a psychosocial impact on the patients.
So what are the types of vitiligo?
The vitiligo more we classify it based on the morphology. Sometimes it's only on the tips of the fingers and toes and on the lips. That's called acral vitiligo. Then it can come anywhere else in the body. It is vitiligo vulgaris. Sometimes it comes only in one part of the body in a particular distribution, that is called segmental vitiligo. And some people have only one patch somewhere in the body, that is called focal vitiligo.
Can it affect children?
Yes, so vitiligo can definitely affect children, and it has more of an impact when it's in childhood. So it is important to recognize it early and treat it early.
What are the diet which you can suggest for vitiligo patients?
So diet definitely does play a role, and we do have some evidence about diet in vitiligo. There are certain vitamin deficiencies that can worsen the progression of vitiligo. The vitamins that are required are vitamin B12, folic acid and vitamin D. Now what you should not take in excess is vitamin C, as it can disturb the synthesis of melanin, which is the pigment.
Some people tell that we have to avoid sour food and all those sour items. Does it really have an effect on vitiligo?
So there is no scientific evidence to say avoid sour foods or anything like that, but yes, there might be some reason for that, is because the citrus fruits which have high content of vitamin C is not good for vitiligo. So maybe that is why people came out with avoiding sour foods, but that's not true. You can take your regular dietary source of vitamin C.
What about vitamin D's role?
Yes, so vitamin D does play a role in overall skin health, and there are many diseases and a lot of research which says that vitamin D is essential for many skin problems. But in vitiligo, we do have some evidence that supplementing vitamin D, especially those with a vitamin D deficiency, it does help in the repigmentation of the patches. So Yamini, you've been asking me quite a bit of questions. Now let me ask you some for a change. And so how does it impact a person? Does it have any internal, people think that vitiligo can cause any internal problems. Is it so, or how does it basically impact anyone?
Vitiligo basically it impacts on a psychological level. Those the children who have vitiligo, they feel that they are not being treated well, and they feel that they should not be playing with the other children, and that brings a lot of psychological impact on them.
People think sometimes, people are afraid that there may be some internal organ involvement. Some people say that if there's a liver problem with vitiligo. So is that true?
No, nothing like that, but it can be associated with a lot of autoimmune disease like rheumatoid arthritis and thyroid disease also.
So a lot of parents who have vitiligo, they are quite apprehensive that their child might develop vitiligo. So is it a genetic problem?
Yes, it is a genetic problem, and currently there are no studies to tell that it can be prevented also.
A lot of people would want to know that if is there something that they can do to prevent the disease progression or prevent it from getting that disease, especially if they have a family history. Can they do something in their diet or their lifestyle?
Yeah, they can increase their diet with a lot of beta carotene, vitamin D and also folic acid, which can help in preventing this disease a lot.
So that's right.
Yes.
So in addition to what you said, also vitamin B12 and certain minerals like zinc and selenium also play a role. And we would rather say that it can prevent the disease progression rather than prevent the disease per se. And it also enhances by taking a proper diet with these correct vitamins, and also supplementation as per the doctor's advice if there is a deficiency can hasten the repigmentation of the patches with our conventional treatments. Now coming to treatments, so what would you, how would you classify each patient? How would you say this would work for this patient, or what is the kind of treatments that are available for vitiligo?
So what we would do is we will look into the patient and we will see whether the patient has a stable vitiligo or an unstable vitiligo. Stable vitiligo, we tell that if the patches or the disease doesn't progress beyond 1 year, we call it as a stable vitiligo. These patients are very good and they are pliable for treatment also. But those who have more than 1 year, we have to bring them under a medical treatment. We have to make sure that the disease activity is reduced and stopped, and then we have to shift them to a medical treatment or a surgical treatment depending upon the size, the site and the area of the disease also.
So yeah, so we divide the treatment into 1 to prevent progression of the disease, and 2 to enhance the pigmentation,
Yes.
get the pigmentation back in the patches. So you're right. So if it is stable, it's much easier to treat, and if it's unstable, we need oral medications. Now coming to oral medications that we have, unstable vitiligo, we have steroids, and now the new kid on the block is our tofacitinib, which helps in repigmentation as well as to some extent stabilizing the disease progression. And so getting the pigmentation back, what are the treatments that are available?
Surgical treatments are available and also topical treatments are available. Coming to the topical treatment, we use steroid creams, and for surgical management we do punch grafting, and then we also try melanocyte cell culture transfer, where we take out the melanin, we process them, and then we apply them onto the area where there is depigmented patches and white patches.
Yeah, and phototherapy I think has a major role to play in the treatment of vitiligo, and the only thing being that every patient has to travel twice a week to a phototherapy chamber, especially if they are in remote areas or in villages where this facility is not available. Then I think topicals and surgical methods are a boon to such patients. But if the unit is available, I think if phototherapy unit is available, I think that would be the best treatment option for getting the pigmentation back. And we also have certain creams nowadays that when exposed to sunlight, it's a kind of topical phototherapy that does help in the pigmentation. When it comes to repigmentation of the patches, what are the treatment options that are available?
The treatment options, we have topical and phototherapy. So in phototherapy we have the chamber where the patient has to travel and get it done, whereas we can opt for the handheld phototherapy unit, which will be more easier to do.
So the patient can buy these units and administer and do it themselves. It may not be as effective as the regular phototherapy unit, but yes, for those who cannot travel, I think that's a good option. And there are also surgical methods, and we've done quite a few patients with very satisfying results. So the surgical options that are available are ultra thin grafting, where we take a thin layer of the skin and apply it onto the patch. Now this can be done if it is a small patch. Now if people have 2-3 patches or larger patches, then we need to do something called as the melanocyte transfer, which is we take a small bit of skin, we process it, separate the pigment cells, and then it's applied onto the white patches, and a particular dressing is done. And then the repigmentation happens around 4 to 6 weeks. So that gives excellent results for those with the stable vitiligo and segmental vitiligo. It gives very good results. So if there's something that you would want to tell our vitiligo patients or patients who are suffering from the disease, what is it that you would like to tell them?
I would like to tell them that this disease is not contagious, and definitely there are treatment options which are available to halt the progression of the disease. And I think that would be it doesn't, and they don't need to worry about the social, psychosocial impact on it. They can get a lot of help through it.
And there are a lot of treatments that are available to completely repigment the skin. And here the key is, I think they should come to us early. And once it's spread and it's extensive, there's nothing much we can do. But in the early stages, yes, we can definitely help them, right?
Yes.
So Yamini, I think we had a wonderful interactive session on vitiligo on this special World Vitiligo Day. And I hope it has benefited and created some awareness on this disease. And I hope it does benefit those who are suffering from this disease. So bye.
Thank you.